Assalamu alaikum. I am Dr. Tanzim Rafat. Welcome you all from the Department of Anatomy. Today our topic of discussion about some anatomical terminologies. Before starting or before knowing anatomy, it is necessary to know these terminologies. These terminologies you find in your textbook, some atlas books. So before any kind of anatomy discussion, everyone should know this terminology. First of all, anterior. Anterior means it is a point which is in front of a predefined point. That means in front of a point which you select from the very beginning. And posterior means is another terminology. Posterior describes a point which is just normally it is called back, then it is called posterior. And medial, which is medial? Medial means the point which is away from the midline. At first, when our body is mainly divided divided by imaginary line which is known as median plane, which is usually passes just through the midline of our body. And median plane is a plane which crosses across the midline of the body, and if we try to understand the medial and lateral, medial means towards the midline and lateral means which is just away from the midline is called lateral. And then another terminology which is known as medial rotation. Medial rotation, that means the rotatory point which is directed towards the midline, and lateral rotation, that means the rotation usually away from the midline is called lateral rotation, or it is a type of clockwise rotation, and lateral rotation is anti-clockwise rotation and medial rotation is clockwise rotation. And superior, the term superior means it is a point which is situated above a predetermined or pre-selected point, that means above. And inferior means a point which is just below a predetermined point. And another terminology which is known as ventral and dorsal, which is as same as anterior and posterior respectively. The term superficial means which is superficial from the body surface, and the term deep denotes that it is deep to the main body surface. And there are some planes in anatomy which is known as coronal plane or the frontal plane, horizontal plane, and then median plane. And some terminology, there are inversion and eversion. In case of inversion of foot, that means when the medial side of the foot is directed medially and when lateral side of the foot touches the ground and medial portion of the foot is above from the ground, it is called inversion. And what is eversion? Eversion means the lateral aspect of the foot is elevated and the medial aspect of the foot touches the ground. So this is the all of our today's discussion. In the next class we will discuss about the next terminologies. Thank you. Assalamu alaikum.